Hi, my name is Courtney, and I'm going to be presenting my project on comparing progressive prompt delay plus reinforcer and clicker training to increase recall in a 4-month-old puppy. So the use of a clicker can make certain skills less challenging to train. And basically, the clicker is used to indicate to the dog when the correct behavior has been displayed. I thought it would be interesting to use a clicker because they're mostly used with working breeds. And my participant Tilly, she is a 4-month-old Belgian Malinois French Bulldog mix, and a Belgian Malinois is considered to be a working breed. So the question that I was trying to answer is a progressive prompt delay plus reinforcer or the use of a clicker more effective at increasing recall in a 4-month-old puppy? The setting, um, the setting was a closed off grass area with minimal to no distractions, and the same setting was used for baseline and both the progressive prompt delay plus reinforcer and clicker intervention. The reason for working on recall, I think it's an essential skill for safety. If the dog were to go near the road, another person or another dog, it's important to be able to call your dog back to you. I also think it's important for other leisure activities such as fetch. There was a previous study conducted where they taught dogs novel behaviors using a primary reinforcer, which was food, and also a clicker, and their results indicated that there was little to no difference between the two interventions. I thought that was interesting. It was very similar to my intervention or my project, except that I also used a progressive prompt delay. So we'll move on to the methods. I used an alternating treatment design with no repeating conditions. So I started with the clicker and moved on to the progressive prompt delay plus reinforcer, back to the clicker, back to the progressive prompt delay plus reinforcer, and so on. So those were my two independent variables, the progressive prompt delay plus reinforcer and the clicker, and the dependent variable was recall. I collected data using frequency data on just a sheet of paper, and I made sure that each session within baseline and both the progressive prompt delay plus reinforcer and clicker interventions all had 10 trials within each session. So how I executed my procedures was first in the baseline. The instructor positioned themselves 10 to 12 feet from Tilly before giving the command here. If the target behavior was displayed, no reinforcement was given. And then in the clicker intervention, the same thing. The instructor positioned themselves 10 to 12 feet from Tilly and then gave the command here. If the target behavior was displayed, then the clicker was pressed immediately and the dog was reinforced with a treat. And then in the progressive prompt delay plus reinforcer intervention, the reinforcer was a tennis ball. And the prompt that was used was a partial physical prompt. And that prompt looked like moving the participant. So they were facing the instructor as soon as that command was given. And in the first session, there was a 0-second delay. So the participant was prompted immediately. And after 3 correct trials, that delay increased by 3 seconds. So started at 0, then went to 3. After another 3 correct trials, it moved to 6 seconds. Another 3 correct trials, it moved to 9 seconds, and so on. I did make the criteria being if the latency between responding exceeds 10 seconds for more than 2 trials, then to reintroduce that progressive prompt delay. So to move on to the results, again, I defined my target behavior as walking or running to the instructor who gave the command here and stopping 1 to 2 feet away from the instructor. In baseline, Tilly was seen able to display that target behavior once in the first session and then once again in the second session. And then in the comparison phase, both the progressive prompt delay plus reinforcer and the clicker intervention showed to be effective, with the progressive prompt delay plus reinforcer being the most effective. So this was that was the intervention that I carried out in the best treatment phase. So to move down to the discussion, both interventions were seen to be effective to teach recall. There were a few limitations. One I noticed in the best treatment phase, a possible limitation. I noticed that the data was slightly decreasing. I was curious to as if I continue taking data, if it would continue decreasing due to possible satiation with the reinforcer being used. In future studies, to make sure that doesn't happen, I could have alternated between two different reinforcers. And then another limitation that I noticed was I live with my nieces, and my participant does have leisure time in the backyard, and I noticed kind of recall naturalistically being worked on. To make sure that doesn't happen in the future, I could have had them maybe if they wanted to play with her, work on a different skill such as stay, or take my dog to a different area where I could control that and know that there wasn't any nobody was working on recall naturalistically. And then I did one of my concerns within this project was my participant becoming prompt dependent. Luckily, that did not occur, but in future studies, I think it would be interesting to see, instead of a progressive prompt delay being used, to use most to least prompting, just in case to avoid any prompt dependency or anything like that. But yeah, that was my project. Thank you, everyone.